Let's discuss about oxytocin, also known as love hormone or love drug. The main reasons for oxytocin used is to enhance delivery, decrease following time, and birth interval as a means to prevent stillbirth. Stillbirth is when a fully developed piglet dies after following or during the delivery process. That is to say, the piglet is born dead. Some works have been done and the outcome was that oxytocin can actually increase the number of pigs stillborn when used incorrectly, especially too early in the delivery process. If you are fond of relying on oxytocin whenever your cell begins to follow, watch to the end to know what you might be doing wrong. The reason for increased stillbirth was an increased number of ruptured or damaged umbilical cords, leading to the compromise of the pig's oxygen supply during the birth process. The function of a healthy umbilical cord is to transport oxygen and nutrients from the mother to the developing baby or piglet in this case. Oxytocin stimulation of the uterine walls will lead to their contraction, leading to dilation of the cervix, which in turn will decrease the interval between piglets' births. That is to state that if the average time for a piglet to come out of the sow is 50 minutes, oxytocin can reduce it to say 10 minutes to quicken the process. Naturally, oxytocin's role is to contract the cervix of delivery mother, and for our case, the sow. It is by the contraction of the cervix that the needed pressure is exerted to expel the piglets smoothly out of the sow. What this means is that if the oxytocin is used earlier before the cervix's own time of opening or dilating, the cervix opens prematurely and with force, which then causes rupture to the umbilical cord, with the cord serving as a medium through which oxygen and nutrients from the mother gets to the unborn piglet. Any damage to the umbilical cord results in deprivation of oxygen supply to the piglets. Talking of risk factors in stillbirth, it is very high in older parity sows that have farrowed severally on your farm. For normal expectancy not under oxytocin influence, stillbirth can begin to occur after the fifth or eighth piglet is born, depending on the litter. With as little as single dose, same stillbirth can start even before the fifth piglet after the first piglet is born. This has been experimentally proven on commercial farms in Brazil, where the data indicated that the percentage of litters with one or more stillbirths was increased on each of the farms when oxytocin was given to the sow sometime during the birth process. The data further indicated that the stillbirths per litter were increased significantly after the administration of a single dose of oxytocin, while the use of oxytocin during delivery process was able to reduce the birth time for each piglet. It increased the number of piglets born dead. The question now is, do you want healthy piglets or you just want to free the struggling sow? Despite the fact that improper use of oxytocin has potentially negative implications on piglets, it also has some benefits during the farrowing process by stimulating the uterine contractions and preventing stillbirths in older sows. This is a clear indication that oxytocin must only be used in older sows in extreme cases, but even with that, the dosage must not exceed half a ml. You might be asking, when should oxytocin be used? It should be used in older sows. Older sows might have lost more of their internal energies due to many farrowing times and must be assisted with oxytocin to contract their uterine walls. Limit usage in goat litters because goats have energy enough to contract their cervix. For a normally farrowing sow, do not use oxytocin until a minimum of 6 piglets have been born or halfway through the birth process. You will know this from the following records of your sow. This is to reduce the number of potential stillbirth cases if they must occur. It is better to get half of the litter very healthy than to lose everything. Also, use oxytocin when a sow has not had a piglet for more than 40 minutes. Remember, the average interval between piglets is 50 minutes. What must the remaining piglets be doing in there after the 40th minute? It is recommended that you use a maximum of 2 doses per sow. To even be more confident in your farm, consult your veterinarian. Being a hormone produced by the hypothalamus in the brain and being excreted by the pituitary gland, oxytocin has many other functions such as helping the breastfeeding process by increasing the amount and quality of milk produced by the sow. It also has the function of bonding and sex. The parental care that sows have for their piglets is partly as a result of the oxytocin in them. Oxytocin equally plays a role during breeding by bringing about heat and bore acceptance. Most heartless sows have little to no oxytocin to feel for their young ones. Here is the Pig Farmers School. If you like the video, consider subscribing to know more about pig farming business.